Hi guys, how are you doing? I hope you are doing well and welcome to today's learning session. Today we are going to discuss a very simple topic but also a very common disease. I think like everybody has ever encountered this disease once in a lifetime or maybe several times. So today we are going to discuss a topic known as urinary tract infection, or in short called UTI, urinary tract infection. So a urinary tract infection is an infection that occurs along the urinary tract system. It is an infection that occurs along the urinary tract system. And the urinary tract system consists of two bladders. My diagram is not so good, but it consists two kidneys, two ureters, one bladder, and one urethra. That is a simple illustration of the urinary tract system. So urine is formed in the kidneys, the two kidneys, they form urine, and then it's transported down to your bladder through the two ureters, the right and the left ureter. And then once your bladder is full, now you have an urge to void or to pass urine. So urine is transported from your bladder outside your system through the urethra. That is the simple illustration of the urinary tract system. Two kidneys that form urine, then transported down to your bladder through the ureters. Once your bladder is full, you will have an urge to void. Then the urine will come out of your system through the urethra. So the causes are bacteria, fungi, and also viruses. But the most common one is the bacteria. And women are the most affected by urinary tract infections because one, they have a short urethra. So bacteria can easily move up from the urethra to the bladder to the kidneys. Number two, because of the closeness of the rectum and the urethra. If you do not practice hygiene well, or after your calls, especially the long calls, if you don't wipe yourself well, the bacteria from the rectum can easily move from the rectum to the urethra. And so once it gets here at the urethra, it will easily move up to the bladder, causing an infection. What are the risk factors of getting a urinary tract infection? The risk factors. Number one, we have hormonal changes. Hormonal changes in women. When you are a pregnant woman, the hormones change because of the purposes of holding the pregnancy. So once the hormones change, they change the normal flora in the urinary tract system, and thus there's a bacteria that is present in women. There's a bacteria that is present in the urinary system in women that is called a normal flora. That means the bacteria is there and it's beneficial. It doesn't cause any infection. But once there is hormone changes, the bacteria can start to now overgrow or multiply. Now it becomes harmful. And also we have menopause. During menopause, the hormones also change. And also these changes, they also change the normal flora, that bacteria that is present. It can overgrow, and once it overgrows, it causes an infection. Number 2, we have antibiotics. There are some antibiotics that once you take them, they just change the normal flora. So when you become sick, you go to the hospital, a doctor prescribed some antibiotics, and during the process of taking these antibiotics, you notice that there are changes in your urinary tract system. They might be caused by the bacteria, so the antibiotics, sorry. So you can go back to your doctor so that he can check and change. We have renal stones. Renal stones is when you have stones either in your kidneys or in your bladder, and these stones, they prevent the normal flow of urine. So let's say maybe you have a renal stone here at the kidneys, then urine won't move out as it's supposed to, because it will be prevented by the stones. And so accumulation of urine in the kidneys or along this system will also lead to an infection. We have diabetes. If you have diabetes, your immunity system is low, and so you are prone to getting UTIs. We have toiletries, excessive bubble baths, pads for ladies, especially this is for ladies. Do not use scented soaps when you are taking showers. Do not douche. Ladies, I know ladies understand what is douching. Yes. And also when you are on your menses, just ensure that you maintain hygiene, bath, and also keep your pads regularly. We have prostate enlargement. This is for male. When your prostate is enlarged, there will be what we call urine retention. Urine outflow will not be as expected because it's enlarged, so it will prevent urine outflow, and there's urine accumulation leading to an infection. We have Indulin Catheters. Those patients who are hospitalized and they are bedridden or they are not able to go to the washrooms by themselves, find that they are on catheters. These catheters themselves, the procedure is sterile, and so if during insertion of this catheter, maybe a bacteria, or if the procedure is not done in a sterile way, a bacteria can be introduced or to your system. And also those patients who have catheters, make sure they are changed after every 14 days. Okay. We also have those people who have multiple sex partners. You're at a risk of getting UTIs. Yeah. And that one is evident. Those people who have multiple sex partners, you know yourselves and you know that you have UTIs most of the time you are treated for UTIs. And also we have poor hygiene. If you don't practice poor hygiene, you predispose yourself to getting a urinary tract infection. So what are the symptoms? What are the symptoms of a UTI, urinary tract infection? Number one, we have pain when passing urine, pain when voiding, pain when urinating, and the pain is burning in nature, and especially when the stream starts. When just immediately you start urinating, you have a burning sensation or pain. Number two, you have an urge to void persistently, small amounts but frequently. Number three, we have an odorous urine. Find that your urine just starts having a very bad smell. We have white blood cells in urine, and also we have high temperatures. Those are the symptoms. A burning sensation when just immediately when you start to urinate. An urge to void several times, frequently, but small amounts. A very bad smell in your urine. And also we have a fever, high temperature. We also have, when you do a urine test, your doctor will find that there's a white blood cells in your urine. That indicates that you have a bacteria infection in your urinary system. Now, how does the doctor know that you have a UTI? Number one, he will do a urinalysis. Once you come with these symptoms, the doctor, the first thing you will do is a urine test. You will be required to give a urine test. And then it will be tested. If there are white blood cells, your doctor will read the results for you. You will have white blood cells in your urine. And also, bacteria can be seen. That is a sign of a bacteria infection. Your doctor will do a urine culture to tell the type of the bacteria. Also, there is a test called a cystoscopy. This is used to assess inside your bladder and also the urethra. The doctor will use a cystoscope to visualize. This one is used to visualize inside the bladder and also the urethra. So what is the management? Once you have a UTI, number one, bacteria infection, you will start on antibiotics immediately. You are advised to take 2 to 3 liters of water in 24 hours. Actually, if you want not to get a UTI, just love drinking water. Penda maji, drink a lot of water. It flushes the system. Even if there's a bacteria, it's just flushed out through frequent urination. So, those are the two major management. You will be start on antibiotics. You are encouraged to take a lot of water, and then you are encouraged to void. Once you have a feeling to urinate, do not hold urine for so long, because once it accumulates, now bacteria can start forming. By the way, urine is very sterile, but once it starts accumulating, then bacteria will just an infection will just form. So what are the prevention measures? Prevention. Number one, ladies, avoid bubble baths. Avoid using scented soaps. Avoid using sprays. Avoid douching. Avoid all those stuff that you use. Just use clean water. That is enough. If you don't have any infection, just use clean water. In fact, you are not advised to use soap. Just use clean water, because even soap can alter the normal flora. So just use clean water. Only water is enough. That is if you do not have any infection, water will sort you. Do not use anything else. Do not use that perfumes that sijui you want to dodge. You use sijui vitunguu saumu, all those things that you use, avoid them totally. Use only a clean water and you are good. Change pads often. This is also for ladies. Change pads often during your menstruation. Ensure you change pads 4 times a day, or depending on how heavy your menstruation is. Because if you do not change for long, also bacteria will come. Void after sexual intercourse. This is advised for both male and female, so that if the other partner was infected, if you void after intercourse, it will flush out the bacteria or the viruses or the fungus. Again, 2 weekly change of catheter. Those patients who have catheters back at home, make sure after every 2 weeks you come to the hospital for change of catheter. Yes, before they introduce bacteria to your system. Practice proper hygiene. Just penda maji, oga. For ladies, after your long calls, you are advised to wipe yourself from front to back to avoid these bacteria from getting to your urethra. You know the rectum has a wide range of bacteria that when they come to contact to your urethra, definitely they will give you an infection. So ensure you wipe yourself from front to back. And then void when in urge. Do not hold urine for so long. Once you feel to void, go and void, because that retention will get you into trouble. You will get an infection. Okay. Yeah, that is the simple discussion of urinary tract infection. Very, very common, but also very easy to avoid. Number one way you can avoid getting a UTI, mostly I'm talking to ladies, drink a lot of water. Just penda maji, because water, when you drink a lot of water, it flushes your system because you urinate more often, so it will flush your system. Yeah, that is it for today. So I hope you have learned something. Yes. So thank you for tuning in. See you in our next discussion.